Thank you for joining us today. Today we'll be talking about the mental health of seniors. So these are your presenters for today.
My name is Hannah McCarthy. I'm a P2 student in the School of Pharmacy.
Hi, my name is Jack Mountain. I'm also a P2 student within the UConn School of Pharmacy.
My name is Kat Irani, and I'm also a P2 student in the School of Pharmacy.
And my name is Bella Tardy, and I'm also a P2 student in the UConn School of Pharmacy.
Okay, so in the next couple of slides, I'll be talking about the general information about mental health. So what is mental health? Mental health is our emotional, psychological, and social well-being. It does affect the way we act, how we handle relationships, in conversations, how we cope with stress in life, how we behave, how we think, and so much more. If you do not treat mental health, if it does go untreated, it can significantly impair your day-to-day life activities, such as going into work, driving, maintaining a healthy relationships with your loved ones or your family. But it is treatable. There is a strong stigma associated with mental health, which is preventing so many people to go out and seek help, unfortunately. So in the later slides, we'll be talking about both the pharmacological and the non-pharmacological treatment for mental health. So in this slide, I'm going to discuss about the relevancy of mental health in our community. So about 1 in 5 adults in the United States have some form of mental illness, and 1 in 24 adults have a serious mental illness. So in those that are 60 years and older, 20% of adults have a form of mental illness, and 6.6% of older adults suffer a disability that is due to the mental and neurological disorders. So mental health is very common as seen in these statistics, and it can lead to other impairments in life as well. So in this slide, I'm going to be talking about the types of stressors. There are 4 different types of categories that someone can go through. So first, we have the psychospiritual stress. This involves losing productivity and purpose. Psychological stress is the next one, and this one involves your emotional stress and cognitive stress. This would involve feelings of sadness, anger, guilt, jealousy, anxiety, and so much more. Our third one we have is physical stress. So this involves stress coming from like a trauma, such as a surgery or a strong infection, intense physical labor, illness, and even dietary stress as well can contribute to physical stress. And then last but not least, we have psychosocial stress. And this would involve having difficulty with relationships, marriage, or having a loss of employment or a loved one. So if you're not treating any of these 4 types of stresses properly and effectively, it can cause a huge toll on someone's mental status. If you're exposed to stress for a long period of time, you're also more prone to infections and immune-related diseases. So now I'll be talking about stress response. There are 3 stages of stress response, with the first being the alarm stage. So this stage will involve your body's fight or flight response, which is your body's reaction to a stressful or frightening event. So your heart rate will increase. Your heart rate will increase cortisol, and this is your primary stress hormone in your body, and an increase in adrenaline, which will ultimately increase your energy. So next we have the resistance stage. So after the fight or flight response, your stress starts to diminish and your body will start to release less cortisol, and your blood pressure and heart rate will start going back to normal. Some situations can be more stressful than others. So you will stay in a period of alarm stress for a while. So you will stay in a period of alarm for a while, and that your body will start to normalize and learn how to live with that high stress level, which can be bad. So being irritated, frustrated, and poor concentration are common signs of this resistance stage. So if you have this stage for too long, your body will start to go in the exhaustion stage. So this is the last stage, and this occurs when you have such a prolonged exposure to stress. You'll start feeling really drained mentally and physically, and common symptoms of this phase include depression, fatigue, anxiety, which can ultimately increase your risk of mental health disorders as well.
All right, so now I'm going to talk about grief and isolation in senior populations. First, introducing what is grief and isolation, and then talking about why seniors are specifically at greater risk for experiencing these sensations. So seniors are potentially at greater risk to experience grief and isolation simply given because of their age. Grief is an emotion associated with processing the loss of someone who has passed away, And as part of the natural life cycle, there are higher mortality rates associated with increased age. As such, older populations are probably more likely to experience grief and grief more frequently from the loss of friends, family, spouses, and so forth. And these types of instances might actually lend themselves to isolation. Isolation is distancing yourself either physically or socially, and it can have, with increased age, you're more likely to either through these factors, like I mentioned with the grief, or as well as chronic illness, mobility types of issues, hearing loss, or other factors, they might contribute to this distancing and make the interactions typically that younger populations might be able to have more difficult. And grief and isolation can respectively lend themselves to poor mental health and as well as physical health through manifestations. So moving on to some of the actual effects of isolation and grief. From isolation, there is a significantly increased risk of premature death from all causes. And this risk actually rivals that of smoking or obesity or physical inactivity. Additionally, there's a much greater increased risk of dementia, as well as increased risk of heart disease or stroke, and loneliness is associated with isolation and is definitely associated with higher rates of depression, anxiety, and suicide. So again, that connection back to the mental health aspects, the further perpetuation of poor mental health. And specifically when talking about grief, the person is likely to experience changes in social and emotional factors with a decreased satisfaction, overall well-being, and increased loneliness and social isolation. And in the acute period following the grief, so right after the grief is experienced, people tend to have a worsening health physically, mentally, as well as potentially weight loss, increased rate of illness, functional impairment, increased rate of heart attack, or increased risk of general mortality. And over the long term, there is the potential to develop something called complicated grief, which is essentially its own mental type of illness, where essentially someone cannot really move past this grief episode. Someone's experiencing this loss to a certain extreme that's so bad that it's consuming in a sense. So moving forward to talk about how to prevent and alleviate some of these sensations in senior populations, one of the primary mechanisms to do so is maintaining engagement. So if you can maintain engagement within the community, seniors are much less likely to experience some of these lonely feelings. Moreover, when you talk about grief, if someone has a support network, they're probably more able to cope with some of the losses that are experiencing and then deal better with the grief and prevent, hopefully, the development of something like complicated grief and alleviate some of the stresses and sensations that come with it. In terms of how to maintain engagement, you look towards either community type of resources or national organizations that can help with that. So when you look at community resources, you might look at senior centers or religious affiliations, churches, and so forth to see if these populations can maintain involvement. You also might consider, if they're able to, mobility-wise and things like that, volunteer work. It's a great way to also maintain involvement within the surrounding community. And if those aren't necessarily options, or if someone is better suited for something like caregiver services, where someone can help go visit the senior and potentially take care of any aspects that they might need help with in their day-to-day, a caregiver service is a great option. When you look at on a national platform, there are some organizations that might be able to help with these types of issues. Specifically, there are area agencies on aging, Elder Care Locator, National Council on Aging, and the American Association of Retired Persons, or the AARP. So now I'm just going to touch on some of the complications between dementia and depression. Depression is very common. I know Kat had mentioned some statistics regarding mental health, and depression is really common during an individual's lifetime. About 1 in 5 will experience some type of major depressive episode throughout the course of their lifetime. But research has found even higher rates in dementia patients, and especially those with vascular dementia, where rates can be up to 50%. And so looking at that, why might this be? Well, the real takeaway is it's complicated. researchers don't necessarily have a full grasp of understanding between the link between these two. Is it a reaction to early cognitive defects where patients experiencing these dementia symptoms are self-isolating and frustrated and basically developing poor mental health because they're dealing with the consequences of dementia? Or is it resulting because of changes in the brain, so the morphology of the dementia disease aspect, creating changes within the brain that lend themselves to developing this depression? Or is it an early symptom or risk factor? Some research has actually shown that having depression earlier in life is thought to potentially be a risk factor for developing dementia later in life. To make matters more complicated, depression does have some behavioral changes that can be associated with it, and depression can induce pseudodementia, is what they're calling it, or what they call it, I should say, where depression and dementia, because they have some overlapping features, they're clinically distinct, but these overlapping features might make it hard to differentiate between the two. So when you look at, say, the behaviors of depression, you might have impairment in attention and working memory, or changes in sleep, or social and functional and occupational functions might be reduced, and that might lend itself also to dementia. So this link is important to consider. It's hard to differentiate between the two, but this link is important to consider when you think about future prevention potentially, if it is a risk factor, or treatment efforts if it's related in morphology as well.
Next, I'll be discussing the impact on mental health, particularly surrounding the COVID-19 pandemic. So the impact of COVID-19 on seniors. Throughout this pandemic, we've seen a disproportionate effect of the changes on seniors and their mental health. So the mental health of seniors has changed dramatically since the start of the pandemic, which is in part due to the adverse effects faced by seniors. If an older adult were to contract COVID-19, they would be at a higher risk of severe complications, hospitalization, and death. People 65 and older make up nearly 80% of all COVID-19 deaths in the United States, which is a haunting statistic. This is a devastating impact, and seniors are in a constant state of emotional stress, which is exacerbating the fear that many of us have felt surrounding contracting COVID-19. Additionally, there has been a disruption of the routines of older adults during the pandemic. Nursing homes and other care facilities have stopped allowing visitors, and many community centers and other local organizations have stopped hosting in-person events. This further serves to isolate seniors. For many, we have found some relief in connecting with people virtually via Zoom or social media. However, for many older adults, there is a challenge both in accessing and operating technology. Finally, seniors may have trouble accessing routine care via telehealth if they're not comfortable or unable to participate in these appointments due to access and technology or just general comfort levels. In cases where this might be the only option to access care, it removes the opportunity for seniors to regularly check in with their providers. At care visits, there's an opportunity for providers to initiate discussions on mental health and to recognize the signs and symptoms of anxiety, depression, and other mental health challenges. Without this opportunity, there are often missed changes in seniors' mental health, as well as a missed opportunity to connect and develop a relationship with a provider. Overall, during the pandemic, older adults have seen an increase in anxiety, an increase in depression, and prolonged exposure to chronic periods of stress, which I'll discuss further. So for the physical effects of long-term stress, there are many ties between long-term stress and physical health. This is often associated with overall worse health outcomes, such as changes in memory or focus, complications with the digestive system, reduced ability of the immune system to fight off infections, increased risk for cardiovascular disease, loss of sleep, and consequential effects of this loss of sleep, including memory and decision-making skills. These changes are particularly damaging for seniors who already report more health complications and concerns than any other age group. Additionally, we recognize that physical health tends to impact mental health, which may lead to a cyclical nature of worsened mental and physical health during chronic periods of stress. And then here, I pulled from a study in the American Journal of Geriatric Psychiatry, which assessed 73 seniors with an average age of 69 years. This study found increased depression, with 44% of participants reporting they feel more depressed since the onset of the pandemic. Increased anxiety, where 45% of participants reported more anxiety since the onset of the pandemic. Increased isolation. Here, 36% of participants reported that they felt completely isolated. This also was a population that was living at home, so it does not include seniors living in long-term care or nursing homes, and reduced quality of life. Here, 72% of participants described their quality of life as being reduced compared to their lives that they were leading before the pandemic. Many cited social distancing specifically for causing this reduced quality of life. And this next slide demonstrates self-reported rates of generalized anxiety disorder and major depressive disorder before the pandemic in March of 2019 and during the pandemic in September of 2020. Here we're able to see that the pre-pandemic percent of reported general anxiety disorder rose from 16.4% to 23.3% during the pandemic. This is a large increase and emphasizes the increase in anxiety experienced by seniors. Similarly, the pre-pandemic rate of major depressive disorder rose from 23.7% to 26.4% during the pandemic in September 2020. It would also be important to consider that many seniors may not feel comfortable reporting or sharing mental health challenges due to stigma or lack of awareness. This may impact the reported statistics and underrepresent the mental health challenges faced by seniors at this time. And finally, to improve the mental health of seniors during the pandemic, many experts have reported the following. So general health and wellness measures, including ensuring proper nutrition and healthy eating to meet energy goals and improve mood and reduce fatigue. Maintaining engagement in physical activities, so walking, yoga. This could provide an outlet to seniors and help them incorporate activity into their daily routine, and ensuring the general needs of those living alone. So those living alone were particularly impacted, especially when grocery stores were seen as unsafe. This is challenging for these seniors to meet their needs. So many volunteer services have opened up and are helping to fill this gap, but it's important that the needs of those living alone are met. And finally, experts are recommending social health interventions, which includes expanding access to telehealth, which will allow seniors to connect more regularly with their providers and provide an opportunity for mental health challenges to be identified and treated. Developing a routine is also important for seniors. This may look different than life before COVID, but it's important to incorporate activities that bring enjoyment and fulfillment into a daily routine. This could include calling a friend or a family member, reading a book, or taking part in a hobby, and improving social connectedness. This will look different for every person depending on their comfort using technology or based on who's living with them in their home. Ideally, caregivers or close family members will be able to improve a senior's skills using technology or provide other opportunities for them to connect within a family. But if the support from a caregiver or family member is not available, many volunteer organizations have worked to provide this service.
So next I will be discussing the different classes of medications used for mental illnesses and mental health, as well as specific medications for the treatment of anxiety and depression. There are many different categories of drugs that may be used to help treat mental illnesses, such as antidepressants, antipsychotics, mood stabilizers, benzodiazepines, stimulants, and antiepileptics. For treating anxiety and depression, a combination of antidepressants, mood stabilizers, benzodiazepines, or antiepileptics used off-label may be used. For our purposes, antidepressants will be discussed further for the treatment of anxiety, depression in geriatric populations. The most common medications prescribed for anxiety or depression in geriatric populations are antidepressants, such as citalopram, escitalopram, sertraline, and venlafaxine. Citalopram, escitalopram, and sertraline are a part of a smaller subset of medications known as SSRIs, or selective serotonin reuptake inhibitors. These medications work at a specific transporter, specifically the 5-HT transporter in the synaptic cleft in the brain, to prevent the reuptake of serotonin, which is a hormone that helps to regulate our mood, sleep, and appetite. Venlafaxine is another antidepressant in the SNRI class, which stands for serotonin norepinephrine reuptake inhibitors. In addition to inhibiting the reuptake of serotonin, there's also inhibition of the reuptake of norepinephrine. Norepinephrine is a hormone that helps to improve mood and reduce feelings of anxiety. For all of these medications, it's important to note that the patient should be started on the lowest dose and slowly increase to a higher dose if necessary. A slow increase is warranted to prevent the risk of adverse effects such as worsened anxiety or depression. SSRIs and SNRIs take 4 to 12 weeks and until effect is recognized. Patients taking these medications should be counseled on these points. So next, mental health practices will be discussed in the following slides. So some mental health practices include sleep, positive thoughts, trying a new hobby, volunteering, diet, and exercise. Getting enough sleep is very important. Many seniors do not get adequate sleep for a variety of reasons, including insomnia, sleep apnea, frequent urination, or pain from a disease state such as arthritis. It is recommended that individuals ages 65 years and older get 7 to 8 hours of sleep each night. Having positive thoughts is another mental health practice. Even when we feel upset, it can be helpful to have positive thoughts. Calling a friend that you haven't spoken to in a while or a family member can boost our moods greatly. Another mental health practice is to exercise the brain by trying a new hobby or staying consistent with a current hobby. Learning how to play an instrument, knitting, or reading a book are some examples. Volunteering is another mental health practice, as many seniors feel a sense of purpose when they volunteer. There are many different ways that seniors could volunteer, such as reading to young children at a local library or by helping out at a soup kitchen. Having a diet filled with foods such as fruits, vegetables, whole grains, lean meats, and low-fat dairy fuels the body and mind and is another great mental health practice for seniors. Exercise is another important way to keep our mind and body healthy. The CDC recommends 150 minutes of moderate intensity exercise per week for older adults. Some examples of exercise include regular walks, aerobics classes, dancing, or swimming. Implementing mental health practices into your life can make a difference in the way that you feel physically and mentally. Some noteworthy benefits include having a sense of fulfillment and well-being, improvements in mood, self-esteem, energy, and sleep, reduction of anxiety, depression, and stress, and clearer thinking. So just in summary, the key takeaway points from this presentation include that mental health relates to how we think, feel, and act. It is important for all ages to recognize what mental health is and how to communicate our emotions with ourselves and others. Stress can negatively impact our physical and mental health immediately, the short term or the long term. By validating our emotions, we can more effectively take action to alleviate our stress. Everyone has been impacted by COVID-19. Recent studies illustrate increased reportings of anxiety and depression, especially in the elderly population. There are many different medications that an individual may be prescribed for anxiety and depression. The most common medications include SSRIs and SNRIs. It's important to note that these medications should be started on the lowest dose and slowly increase if necessary. And lastly, important mental health practices for seniors include getting 7 to 8 hours of sleep each night, eating a diet rich in fruits, vegetables, lean meats, and whole grains, and getting physical and mental exercise. So thank you again for your attention. And if you have any questions, please feel free to reach out to any of us by email.